everyone, welcome to the third episode of our heart failure educational series. Today we have Dr. Julian Loh. He's a heart failure cardiologist practicing at the National Heart Centre. Hey, Dr. Julian, heart failure is a dreaded disease, and there are some patients with intractable symptoms despite being on several medications and several therapies. What would you do for these patients?
Heart failure is a spectrum of disease, and when people start getting very severe symptoms, when the medication doesn't seem to work as well, those patients tend to be termed advanced heart failure. About 10% of people who develop heart failure will eventually get to the stage of advanced heart failure at the 5-year mark. And these patients are characterized with very severe symptoms of shortness of breath. They come into the hospital very frequently because of congestion and fluid overload. So it's a very severe disease, and it has very bad outcomes.
We've also heard about some of these patients receiving a therapy known as a heart pump. Could you tell us a bit more about this?
So this is a third-generation heart pump, what we call a left ventricular assist device. So the left ventricular assist device works with the heart to assist the heart in pumping the blood around the body. If I may turn this model around, you can see the left ventricular assist device here. There is a cable attached to the pump, and that is called the drive line. The drive line exits the abdomen. It's connected to a pump control, and from the control, it's then attached to the battery. The left ventricular assist device is an extremely wonderful device from a technological perspective. The main advantage over the previous generations is the reduction in bleeding and the reduction in clotting. And because it has reduced the bleeding and clotting rates, it has actually improved survival of patients of the left ventricular assist device, so much so that the short and medium term 2 to 5 year survival is equivalent to heart transplant, which is the gold standard of treatment in heart failure. It does have certain downsides or complications that we need to look out for. One of the complications is that we are supporting one side of the heart, we're supporting the left side of the heart, but we're not supporting the right. So right-sided heart failure is something that we need to look out for very closely. And because you have a drive line exiting the abdomen, there is a risk of bacteria entering and leading to infections. So infections, right-sided heart failure are the two main complications that we need to look out for after the left ventricular assist device has been entered.
Thanks, Dr. Julian, for telling us more about this pump. What sorts of patients would be suitable for a pump like this?
The people who are suitable for this pump are people who display features of advanced heart failure. They then go on to do certain tests to make sure that we think that they have a very poor prognosis, and if they display all the features suggesting that they have an advanced heart failure phenotype, and if they don't have any barriers or any problems undergoing the surgery, then they would be patients that we would consider for the mechanical heart pump.
So Dr. Julian, an advanced heart failure cardiologist like yourself would have seen quite a few patients being on these pumps. How are they like after these pumps have been put in, and what sorts of changes do they have to make to their lives?
This is a major surgery, so there is a period of recovery, and the patients will have to sort of try to get their strength back. But usually after the pump goes in, patients feel a lot better. They notice they're a lot less short of breath, their exercise tolerance gets better, they're usually very happy now that the pump goes in. And usually after the pump goes in, one of the major problems we face is patients putting on too much weight, because that becomes a barrier to them receiving a heart transplant. There are a lot of lifestyle limitations, well, a few lifestyle limitations that they have to undergo once the pump goes in. As we mentioned, there is a wire or a drive line coming out of the abdomen. They need to keep the area dry. When they shower, for example, they need to make sure the area is covered. They can't swim, for example, because of the drive line coming out. They need to make sure that they know how to handle the pump, how to charge the batteries. So these are all things that they need to learn and get used to.
Being diagnosed with advanced heart failure is a massive diagnosis. What would you discuss with your patient at that point?
So I think one of the main things that we need to discuss with our patients once they are diagnosed with advanced heart failure is we have to be honest with them, and we have to talk to them about the dire consequences of the diagnosis. This is the end stage of a disease. It is associated with very high rates of passing away, very high rates of recurrent admissions to the hospital. The second thing we need to discuss then would be advanced care planning. We would like, ideally, to discuss what happens if the patient turns unwell while the patient is well, so that everyone is under a lot less stress. Usually when it comes to that stage, we are coming to a fork in the road. we either choose to explore a more palliative comfort care approach, a more palliative paradigm, or we go to a more aggressive strategy where we explore options of high-risk surgery that include mechanical heart pumps or heart transplants.
Instead of a heart pump, what about patients who go for heart transplants instead?
Well, heart transplant really is the gold standard of treatment for heart failure. Essentially, you have a pump that's not working. You take out the pump and you put a brand new pump in. The major problem with heart transplant, of course, is organ availability. There are a lot more patients with heart failure than there are organs available for a transplant.
The journey of a patient with heart failure is not easy. Are there any support systems in place to help these patients?
Our heart failure patients tend to have many aspects of their care that need to be addressed. So that's why when we treat a patient, we work together as a heart failure team. So I think one of the first areas of support is the multidisciplinary team. The heart failure nurse is really the center of this team. She is usually the liaison between the patient, but it also includes people like pharmacists, physiotherapists, occupational therapists, medical social workers. Beyond that, there are a lot of patient support groups because heart failure is a very common diagnosis. There are a lot of other bodies that provide avenues of support, including the Heart Failure Society of Singapore, including the Singapore Heart Foundation. There are a lot of patient support services available from there as well. Heart failure has been identified by the Ministry of Health as a disease of concern. And so there's a lot of resources being poured into the support of our heart failure patients.
Thanks, Dr. Julian, for sharing with us so much about advanced heart failure and how to manage it. It's been a pleasure having you here today.
Not at all. The pleasure's mine. Thank you.
For the rest of us, this is the end of our educational series by the Heart Failure Society Singapore. For more educational content, you can head on down to the Heart Failure Society Singapore's social media platforms.